Hello and welcome. Let's start by finishing off basically fluid, electrolyte, and acid balance is what we'll move into. So we'll get to 14 kind of taken care of there. Now here, when we go through and we talk body fluids, we'll start first by talking about body water content. Now, when we talk about body water content, I'd like you to know when we talk infants are going to be about 73% or more water. They're going to be made up of 73% or more of water. They have low body fat and low bone mass there as well. Now, when we talk a healthy young man, a healthy young man is about 60% water. And a healthy young female, a healthy young woman is about 50% water. Is about 50% water. Now, this difference between the sexes, it reflects the fact that females have relatively more body fat and relatively less skeletal muscle compared to males. So you can see here they have higher fat content and less skeletal muscle mass compared to males. And when you talk adipose tissue, adipose lipids, right? Adipose tissue, least hydrated of all. Water and oil, they mix. And that's kind of one thing we can use there to understand that. And water content declines to about 45% in old age. As we age, you can see water content begins to decline. Right, next, then we have fluid compartments. So when we talk fluid compartments, we can see, we'll go through, and we've talked about before, we'll go through and we'll revisit them. We saw them in the beginning of the semester. So here now when we go through and we talk about fluid compartments, first you can see total body water is about 40 liters. Now here when we go through and we talk about water, I want you to know water is going to be found occupying two main fluid compartments within the body. First you have what we call the intracellular fluid compartment. So what we'll do is let's draw a cell. And here we have inside the cell, intracellular fluid compartment. Okay, now this intracellular fluid compartment is going to contain about 2/3 of our total body water. It will contain about 2/3 of our total body water. Now the remaining 1/3 of our body water is outside the cells, like we've drawn in class as well, ECF, extracellular fluid. So the remaining 1/3 of the body water is outside the cells. It's found in the extracellular fluid compartment. Now this extracellular fluid compartment itself is going to be subdivided into two subcompartments. It'll be subdivided into two subcompartments. And those subcompartments include, you can see here, number one, you've got plasma. Number one, we have plasma. And number two, then, we have, you can see, our interstitial fluid. Plasma, okay, plasma you'll see is basically the fluid portion of blood, if you recall. And interstitial fluid is going to be the fluid that you're going to find in the microscopic spaces between our tissue cells. So basically the space in between the cells. So this gets further subdivided into, we said plasma, and then also interstitial fluid. Okay. Now let's talk about the composition of body fluids. Let's look at the composition of body fluids. Now, when we go through and we talk about the composition of body fluids, you can see in here they're depicting to us the same exact thing as well. ICF. And then here you can see we've got ECF. And that ECF further subdivided into plasma and interstitial fluid. So now when we talk about the composition of body fluids, Water is going to serve as the universal solvent. Water is going to serve as the universal solvent in which a variety of solutes are dissolved. Solutes may be classified broadly as electrolytes and non-electrolytes. So when we talk electrolytes and non-electrolytes, non-electrolytes are organic molecules. And it will include molecules like glucose. It'll include molecules like glucose, lipids, creatinine, and urea. When we talk electrolytes, we'll see electrolytes are chemical compounds that dissociate. They're chemical compounds that dissociate into ions in water. And they can conduct an electrical current. Electrolytes include inorganic salts. When we talk electrolytes, this will include inorganic salts, both organic and inorganic acids and bases, both organic and inorganic acids and bases, and some proteins. Electrolytes have a greater osmotic power. Electrolytes have a greater osmotic power than non-electrolytes compared to non-electrolytes because each electrolyte molecule dissociates into two ions. So again, when we talk electrolytes, they have greater osmotic power than non-electrolytes because each electrolyte molecule dissociates into two ions. For example, a molecule of sodium chloride contributes twice as many solute particles as glucose does. Now, electrolyte concentrations of body fluids are usually expressed in milliequivalents per liter. They are usually expressed in milliequivalents per liter, right? It'll be something like this. You can see lowercase m and then a capital E. And here we have got a Q. Milliequivalents over liters, per liter. A measure of the number of electrical charges in 1 liter of solution. So it's a measure of a number of electrical charges in 1 liter of solution. Let's compare then the two environments, inside and outside. I mean, we've done that many times before, but here we'll look at it in a little bit more detail. So when we go through and we talk about comparing extracellular and intracellular fluids, I'd like you to know, I have a picture here too. Yeah, here's an image here as well. Here we could see basically one image. Yeah. Now, extracellular fluid, and then here you've got all the content there. Extracellular fluid has a main cation, which is sodium. You know that, you've learned that, and you're all experts at that now. And the major anion is chloride, right? We've discussed that as well. ICF, the intracellular fluid, contains only a small amount of sodium and chloride. Its most abundant cation, potassium. It's going to be potassium. Its major anion is hydrogen phosphate. Also found inside Near the membrane are proteins. Near the membrane, inside are going to be proteins, which give that inside area right near that membrane its negative charge, that characteristic negative charge that we've discussed many times in the last chapters. Next thing we can discuss abnormalities in acid-base balance. Now, when we talk about abnormalities in acid-base balance, here we can go through and we can see we've got basically cases of acidosis and alkalosis is what we're going to be looking at. Now, these cases of acid-base imbalance we're going to look at and we're going to check out and balance. We'll see here as well. They can be classified according to a cause of either being a respiratory cause or being a metabolic cause. So when we go through, we'll look at respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis there as well. Now, when we go through and we talk about respiratory acidosis and respiratory alkalosis are going to be pH imbalances. They are pH imbalances that are going to result from some failure of the respiratory system to perform its normal pH balancing roles. First, we have respiratory acidosis. When we talk respiratory acidosis is the most common cause of an acid-base imbalance. It most often occurs when a person breathes shallowly, where you have hypoventilation occurring, or when gas exchange is hampered by disease or an obstruction, where you have rebreathing of CO2 occurring. So here what happens is CO2 accumulates in the blood. Now, when CO2 accumulates in the blood, we refer to that as hypercapnia. So, in respiratory acidosis, CO2 accumulates in the blood. Thus, respiratory acidosis is characterized by falling blood pH and rising PCO2. So, hydrogen ion content starts to increase. You can see here bicarbonate ions also increase. CO2 increases. So if we were to add in here pH here would be obviously going low, right? These are usually the three factors they'll give you, three numbers they'll give you: 1, 2, and 3. They usually won't show hydrogen ion content, but here you've got to understand that because that's what's going to be increasing. In respiratory alkalosis, this results when CO2 is eliminated from the body faster than it is produced. Hypocapnia here. So this is called hyperventilation. And it results in the blood becoming more alkaline. And this results more often from stress or pain. So alkalosis, pH is going up. Hydrogen ion content is going down, right? You can relate those two. And here, CO2 levels are decreasing versus what we saw in acidosis where they were accumulating. So you pick up on those two things there, you have enough of an idea of where you're going then. And then you'll be able to pretty much predict basically bicarbonate levels there in some patients. Next then, let's move down. Let's move down to metabolic acidosis and alkalosis. Now, when we talk about metabolic acidosis and alkalosis, they will result when bicarbonate ion levels go below or above the normal range. The normal range is usually about 22 to 26 milliequivalents per liter. So let's talk metabolic acidosis first. Metabolic acidosis is the second most common cause of acid-base imbalance. It's recognized, acidosis, so I just shouldn't have to tell you pH, you already know which way that's going. It's recognized by low blood pH and low blood bicarbonate levels. Now, causes are going to include ingestion of too much alcohol and excessive loss of bicarbonate, which can happen from persistent diarrhea or from the accumulation of lactic acid from either exercise or diabetic crises, from starvation, and also from kidney failure, to mention a few situations that could lead to then these problems. So causes include ingestion of too much alcohol and excessive loss of bicarbonate. Now, metabolic alkalosis. Metabolic alkalosis is indicated by rising blood pH and bicarbonate levels. By rising blood pH and bicarbonate levels. So if we're to add pH here, acidosis, you can see it'd be coming down. If we're talking pH, right here it's going up. So here you can kind of use bicarbonate, you see, and pH levels going in the same direction. Right, you see that here, and then same thing in here. Compare, in acidosis, bicarbonate and pH both going down, and in metabolic alkalosis, both going up. Just basic idea, just basic. I mean, this isn't with compensation and all of that happening and kicking in. Obviously, that's going to make it much more harder and much more complicated to be able to get in and see what is happening there. But just to give you the basic idea, basic idea. Now we talk metabolic alkalosis, so think about this. Alkalosis, so not enough acid. This results usually from vomiting. Vomiting, what are we removing? Acid content from the body. Okay, or by intake of excessive base, or a patient is intaken excessive base, suicide, or these other situations, accident as well can happen there too. All right, this concludes then this second part.